Let's discuss neurofibromatosis. This is the first part of the video where we'll talk about neurofibromatosis type 1. Let us see a question. 3-year-old boy presents to his pediatrician for multiple hyperpigmented lesions on the skin. Family history is significant for a genetic disorder in which his father have a similar skin lesions that are much larger. So there is a positive family history. Medical history is otherwise unremarkable. On physical exam, there are 7 cafe-eulate macules about 6 mm in size throughout the body along with the axillary frecklings. So this is in the photo you can see the cafe-eulate macules, and that are much larger in size, and there are also axillary frecklings. These are the two classic presentation for the neurofibromatosis type 1. It is an autosomal dominant disorder that can present with cafe-eulate macules, neurofibromatosis, least nodules, axillary and inguinal frecklings, which were seen in the question. It can also be associated with pheochromocytoma and optic glioma. So these are the clinical features which can be present with neurofibromatosis type 1. Let's talk about the pathophysiology. There is a mutated NF1, that is neurofibromatosis 1 gene insufficiency, that creates neurofibromins. These are the neurofibromins which are the tumor suppressors, and this in turn dysregulates cell growth and the development. Talking about the genetic part, it is autosomal dominant as we talk about, and it is NF1 gene which is involved, and mostly it is on the chromosome 17, and the defect usually is 17q11.2. This is the genetic defect that we could see, and there is complete penetration but variable expression may be seen. If we talk about the presentation, physical exam, as we see there are cafe-eulate spot which we also saw in the picture. It is typically by the age 2. There is axillary inguinal frecklings and cutaneous neurofibromas, least nodules, which are usually seen in iris. If we talk about the diagnosis, making the diagnosis is clinical diagnosis mainly and typically made in children, and genetic counseling can be also done. If we talk about the treatment is targeted to clinical manifestations, and for example surgical removal of the discrete neurofibromas. Talking about the complication, there is high risk of malignancy in this children, and prognosis is usually associated with increased mortality. And then in the next video we will talk about neurofibromatosis type 2. Thank you.